Hello. In one of my previous videos, I talked to you about dizziness, which may occur suddenly or it may be recurrent. Now, some of my patients can't tell whether they are dizzy or whether they are unsteady or whether they are off balance. This is a common problem, especially in the middle age and as one gets older. Now, what can be the reasons if you experience dizziness or unsteadiness or off balance? Now, there are a number of reasons for this. I'll go through the reasons one by one, and you may have more than one reason contributing to your dizziness or unsteadiness or feeling of off balance. So, starting off with the ear or the vestibular system, you may have a condition called benign positional vertigo. In this condition, as the name suggests, you have dizziness when you bend down to pick something up, when you turn your head to the left or to the right, when you lie down in the bed and you try to get up. This condition requires some form of vestibular rehabilitation where you will be taught certain exercises, and after doing these exercises, the benign positional vertigo may either be reduced substantially or may totally go away. Now, the other reasons for this feeling of unsteadiness and off balance are diseases affecting the brain, such as you may have lack of blood supply to certain areas of the brain. You may also have abnormalities in the cerebellum, which is involved in your balance. Or if you have excessive fluid in the brain, a condition called hydrocephalus, you may also have a feeling of unsteadiness and off balance. If you have a disease affecting the spinal cord or the spine, that can also contribute to feeling of unsteadiness and off balance. And if you have a disease affecting the nerves of the legs, this can also make you feel unsteady and off balance. So by a clinical examination, sometimes it's possible to determine if you have a disease affecting the spine or the brain or the nerves. Sometimes certain tests need to be done to determine if you have these conditions, such as an MRI of the brain, an MRI of the spine, and a nerve test of the legs. Sometimes this dizziness and unsteadiness is not due to a condition in the central nervous system. The vestibular system, the brain, the spinal cord, and the nerves are all part of the nervous system. Sometimes you have things outside the nervous system which may make you feel dizzy or unsteady or off balance. One of them is vision problems. Now, if you have a vision problem such as cataract or problems in your retina, which is at the back of the eye, you may also feel dizzy and unsteady and off balance. Now, the reason for this is the eye and the ears and the balance receptors in the legs are all important for someone to feel steady and in balance. So when any of this is affected, be it your eye or your ear or your balance receptors in the legs, you start feeling unsteady and off balance. So this is the reason why if your vision is affected, you may feel unsteady or off balance. In some people, problems of the heart may cause them to feel dizzy or unsteady and off balance. Now, these problems may be postural hypertension or a drop in blood pressure from lying to standing, and this may occur due to taking certain medications such as blood pressure reducing medications. If you have an irregular heartbeat, this may make you feel unsteady and off balance. If you have a problem with the structural condition of the heart, such as an aortic stenosis where there's a narrowing of the valve, or if you have an abnormality in the heart musculature, so the pumping action of the heart is not optimal, you may also feel dizzy and unsteady and off balance. The other reason why you may be feeling unsteady and off balance is if you have arthritis. Now, arthritis may contribute to your feeling of unsteadiness because you may be weight bearing using one leg more than the other. Hence, you feel unsteady and off balance. So, as you can tell from this list, diseases affecting the ear, the brain, the spine, and the nerves, and diseases affecting the eye and the heart and the joints causing arthritis. So, you may have one or more than one of these factors causing your unsteadiness and feeling of off balance. Now, why do I stress this condition? Because unsteadiness and feeling of off balance is a very important cause of falls in the elderly. And falls in the elderly are quite detrimental because you may have fractures involving your wrist, you may have a fracture of the spine, and you may fracture the hip bone. So it's very important if you feel dizzy or unsteady and off balance to keep these conditions in mind. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.